Frontline workers, caregivers, parents, and everybody in between are struggling with the impacts of the pandemic. Joining us now is Christopher Anderson with the Crisis Response Network to talk about resilience during this time. Thanks so much for joining us, Christopher.
Thanks for having me. Appreciate it.
First off, how important is resilience to cope during this time?
Resilience means a lot of different things to a lot of different people, but what it means in terms of this program, we're looking for those underlying strengths that people have that they can tap into. And when a pandemic is affecting all different aspects of their life, it really challenges people to their core. A lot of the same coping mechanisms that they may not have had previously. They're looking for connection points, they're looking for opportunities to work, they're looking for a lot of different things that mean so much to them in their day-to-day. And a lot of those things are non-existent or not reachable for them. So resilience really means tapping into the strengths that people have and showing them new ways to access them.
Okay, so Christopher, tell us, what is the Resilient Arizona Crisis Counseling Program?
The Resilient Arizona Crisis Counseling Program is a program at the Arizona state level that is in direct partnership with FEMA, SAMHSA, and the state's Department of Health Services that allows behavioral health professionals to reach every Arizonan that's being affected by the pandemic, mentally, emotionally. And what this program is really designed to do is give Arizonans an opportunity to learn new coping skills, but also just to talk to a professional about how it's affecting them. And this is born out of disaster behavioral health responses that have taken place for decades across the country. FEMA and SAMHSA have regularly gone into communities affected by natural disaster like hurricanes, tornadoes, flooding. Obviously, the pandemic is affecting people a little bit differently coast to coast, but this is Arizona's way of giving Arizonans an opportunity to speak with a professional free and anonymously.
And the program is absolutely free, is that right?
It is. It's totally free. It's funded with grant funding from FEMA, the Federal Emergency Management Agency, and SAMHSA, the Substance Abuse and Mental Health Services Administration, which is part of the U.S. Department of Health and Human Services.
Christopher, tell us a little bit more about who this program ideally is for.
The Resilient Arizona Crisis Counseling Program is for any Arizonan that is affected by the mental stress of the pandemic. So common things, anxiety, grief, isolation, the fear of becoming ill. But there are obviously some groups in Arizona that we're really trying to reach because we do consider them even more affected than others. Those include healthcare workers, seniors, caregivers, and the tribal communities.
How does crisis counseling differ from mental health treatments?
Key difference between traditional mental health services and crisis counseling is the way the services are provided. So mental health treatment implies assistance to individuals for a diagnosable disorder. Typically, mental health professional and a client discuss various treatment options, agree to certain interventions, treatment goals. In contrast, crisis counseling seeks to prevent the onset of those diagnosable disorders by helping individuals understand they're experiencing common reactions to extraordinary circumstances. Really, what we're trying to do is normalize the conversations with people that this pandemic is affecting almost everyone. So the crisis counselors treat each individual and a group session as if they're the only person. They really want to find out how this pandemic is affecting that person and inspire that person to figure out ways to cope. But more than anything, just normalize. People are not alone right now.
Christopher, are there programs like this around the country?
Yes, so the Resilient Arizona Crisis Counseling Program is one of many across the country. Many other states and counties are running similar programs. Again, this is in direct partnership with FEMA and SAMHSA, so we are one of many, but these types of services are definitely rolling out nationwide, and that's a good thing.
Where can people get more information on the program?
The primary way that people can get in touch with the service providers in their area is simply calling 211. So anybody calling from an Arizona number, you just dial 211 and you'll be connected with a specialist that can get that person scheduled with provider in their area.
Christopher, thanks so much for joining us today. This is such valuable information. If you'd like more information on the program, head to the website, or for help or assistance, dial 211.